Hi, my name is Patrick Grover, and I'm a neurosurgeon at the National Hospital for Neurology and Neurosurgery in London, and also the Cleveland Clinic in London. And today I'm going to talk to you about vestibular schwannoma. So, vestibular schwannoma is a benign brain tumour. It grows from the hearing and balance nerve, and usually it presents with unilateral, so single-sided hearing loss, ringing in the ears or tinnitus, and also sometimes balance disturbances. It's a relatively common tumour in our practice, but quite rare in the general population. And aside from hearing loss, the risks with this tumour is that it can grow slowly in towards the brain and cause nerve damage or even more significant symptoms if it gets very large. So these tumours tend to grow 1 to 2 millimeters a year. And the main thing is that it's a benign tumour. It's certainly not cancerous or malignant, and it's also very treatable. Now, the key thing about treating vestibular schwannomas is it's very important that this is done in specialised centres. They're managed with what we call a multidisciplinary approach. So particularly it requires a combination of skull-based specialised neurosurgeons working in collaboration with skull-based specialised ENT surgeons. The operations are done always as joint operations between these two specialists. And if you visit a surgeon to talk about the management of this tumour, it's important that you're seeing someone who does high volumes of this kind of work. So really should be regularly treating this kind of tumour on a weekly or at least every few weeks basis. So in general terms, the treatments can be stratified into 3 groups. Many of these, particularly the ones that might present later in life and are quite small, may never grow. So we diagnose the tumour, but then actually the initial management is surveillance. So a repeat scan at 6 months is the norm for most patients, unless you have significant symptoms that require addressing at presentation. The second treatment option will be surgical excision, and certainly that's the best treatment, particularly for the larger tumours and the ones that are already causing neurological compromise. And in a busy practice, as mine is with my ENT colleagues, usually we would operate on this kind of tumour every 2 weeks or so. And then third option is gamma knife radiosurgery. And in the modern era, that's really actually the most common treatment for vestibular schwannomas. So 70 or 80% of growing vestibular schwannomas these days will be treated with a form of focused radiation treatment such as gamma knife radiosurgery. And that's very effective for the smaller tumours. It can stop them growing in 90 to 95% of cases, and the side effect profile is very low. So that's a quick summary of the management of vestibular schwannoma. And if you do have one of these tumours or you're concerned that you have unilateral hearing loss, then I would advise seeing a clinician at the earliest opportunity for discussion.